89% of frontline workers vaccinated. Is it best practice for nurses who aren't vaccinated to be working in COVID?
So as of tomorrow, I will mandate, as I've been saying now for several weeks, to the hospital and health services that only people who've had their first dose of the vaccine, whether it be Pfizer or AstraZeneca, can work directly with confirmed cases of COVID. Wow. Yes, and that was always our plan. So we did set ourselves that target for between 4 and 6 weeks to get all of 1A workers vaccinated. We've reached that. We believe we'll have finished that by tomorrow. And then the plan was always, once we had people vaccinated, because we needed to have people available to look after all these cases. And as you heard earlier, we've gone very, very rapidly from 5 cases in just over a month to 78. So we need staff to look after these cases, and I'm very grateful to the staff who have been doing this work. Of course I am, and all of us are, and now all of those staff will have had the opportunity to be vaccinated, so it will be mandated that only vaccinated staff can work directly with COVID-positive cases. Because we didn't have enough vaccine. We had to roll the vaccine out. It's just so unfortunate that this outbreak has occurred when it did. Another month and all of these staff would absolutely have been protected. She wasn't managing COVID cases. There's a difference. I don't know. I found this out late last night. That is the really important work that the staff are all doing today. Yeah. No, they've done their best to do that. But as you've heard, the numbers of cases has just ramped up at the same time as we're trying to vaccinate people. So we've had to then vaccinate more people. So we started with a smaller number in 1A, and that number has increased because we've seen this big increase in case numbers. So the PA has been doing an absolutely first-class job, as has all of our hospitals. No, there isn't a concern, but of course we are looking at this and how it's happened. But as I said before, I don't know how the transmission event, because it's too early to know. It's not because we haven't looked, it's just too early. So I found out very late last night the genome sequence result. That was quicker than I thought. I thought I'd be getting it this morning, so they've done a first-class job there. And finding that out last night, we've then been talking to the HHS to go and test all the staff in that area to see if there's been another case or if there's been direct transmission from the patient to this nurse. That's correct. Yes, so one of the... No. Thank you for raising that. One of the positive cases in that second cluster attended the Hens party as an entertainer, and he came back and he lives in the Gold Coast and he works as a tradie, and he did go to an aged care facility in the Gold Coast. But every resident in that aged care facility has already been vaccinated, had their first dose. I haven't got confirmation about whether any have received their second dose. He's one of those 5. That's correct. He's one of those 5. So we're working with the Commonwealth to respond to that aged care facility. The team down at the Gold Coast are organising to go to the facility today and vaccinate the staff of that facility. Yes. Oh, I'm not sure. I haven't got that information.